Some patients walk into the hospital by themselves, while others are brought in by an ambulance. You must be prepared for facilitating these movements of the patient by consistently coordinating with the workforce in the hospital. While shifting a patient from the ambulance to the ward, you must gain an understanding on the condition of the patient and coordinate the process with other assistants if needed. The patient is confined to the bed during the stay in the hospital. However, for some procedures, they need to be moved from one ward to another. You should collect all the details of the patient from the nurse before planning the transfer. The transport procedures involve the use of varied equipment such as wheelchairs and stretchers. You should be aware of the usage of these equipments and take necessary precautions while handling them. You should take certain precautions with respect to the physical condition of the patient and also take some protective measures to prevent any undue physical strain on yourself. Safety measures in handling equipment. The basic equipment used in the transport of the patient are the stretcher and the wheelchair. While using a stretcher or a wheelchair, ensure that wheels of the equipment are locked. This will prevent any undue movement while the patient is being transferred. If the stretcher is provided with side rails, ensure that side rails are lowered before the transfer and raised back into place once the transfer is done. Ensure that the stretcher bed is rigid enough to support the patients, especially in case of patients with a weak back. While moving the stretcher or the wheelchair, take care while you move the patient on uneven ground. Do not rush the movement. Do not stop or start moving the wheelchair or the stretcher with a jerk. Initiate or stop the movement smoothly. The medication equipment such as the drip or the breathing support system attached to the patient should be stabilized with the stretcher or the wheelchair. Safety measures while handling the patient. The most important precaution that you need to take while handling the patient is getting all the information about the condition of the patient. You must understand the pain areas of the patient and be sensitive to the movements of those areas while transferring the patient. Do not hold and lift the patients by their armpits while lifting them from a wheelchair. Always use a belt that can be used to hold the patient in position. When you use a blanket for lifting the patient, lift the patient gently with the help of the other assistants holding the blanket gently. You should also avoid undue strain on yourself when you lift the patient. Do not take the burden of the patient's weight on your back. Always use the powerful muscles of your legs, thighs and arms in lifting and moving the patients. In order to avoid undue strain on your back while using the transfer equipment, adjust the height of the equipment to the level of your waist. Hold the patient as closely as possible to your body. Do not let the patient slip or roll away. Always slide the patient gently into the wheelchair or the stretcher.